Alright, so I am dressed and prepared to go into an isolation room. It doesn't matter what order that you put your isolation garb on, just get it on. I, for example, right now have a fluid shield mask in place of just the regular eye shields. Certainly this is much more, it is a better choice financially.
Cost effective.
The glasses are not very cost effective. I need my gloves, and as I put my gloves on, I want them to cover my cuffs. These are not sterile gloves, non-sterile gloves that do come up and cover my cuffs.
And no jewelry.
Yes, I don't have jewelry on. Okay. I have put my watch in the bag because I don't have a clock in the room, and certainly I would not be able to see my watch at this point. So I put it in a bag so I could take it into a room. The place where I would be getting my garb on and gathering my supplies would be called the anteroom, which is a small room right before you go into the patient room. So there would be a door before I go into the patient room here. The anteroom usually will have your supplies. You want to be very organized as you're going in, because certainly you don't want to have to go in and out so many times in a day. I'm going to say I'm going to change linens. If I'm going to be bringing linens out, I'm going to need to double bag them as I come back out. So I'm going to take a linen bag in there with me. I know this is red. We'll say it's actually not a biohazard bag, but it's a yellow bag for linens. Very often facilities will use a dissolvable bag, so you might want to take that in and actually put the linens in it. If, for example, if I were going to need to do a culture, I had a physician's order that said do a culture, I would take that in with me, and then a biohazard bag to put that in. And again, this will be double bagged as I come out. Very often there's a window in that door so that you can look in the room, scan the room to see if there's the supplies in there that you need. It's normal that they would leave a blood pressure cuff and a stethoscope in the room, usually using disposable things so that they can be thrown away at the end. You want to have stuff like pencil, paper, some extra alcohol wipes, sanding wipes, that type of thing, because you'll need to use those as you're in there. Okay, so I knock, I enter my room, and I've greeted my patient. My goal is to provide all the necessary care while I'm in here, again, so I'm not going in and out so many times. I have my equipment. I know that in an isolation room we have a reverse airflow, so usually you can see that big square thing over the patient's bed that draws the air away from the patient. I know that the closer that I am to the patient, then the more germs there will be. If I have things that I need to lay down, and for example, I don't want them grossly contaminated, I might choose to say maybe lay them on a chair by the door as opposed to closer to the patient where it's going to be more contaminated. So I've laid my stuff down. As I'm doing care for the patient, I want to try to face the patient as much as possible so that more of the germs are contained on the front side of me, and I know basically I can kind of control that. I don't want to lean up against the bedside, again, to become more grossly contaminated. And again, if, like say, for example, if the patient had been incontinent, then I'm going to be wearing it too. So be cautious of that. In this room, I have a stethoscope in the room. Now, certainly, it is not a risk to the patient, but it would be a risk to me to just pick this up and use it. I'm going to have sandy wipes or some alcohol wipes, and I am going to thoroughly cleanse this prior to using it, just to protect myself, because certainly I wouldn't want to pick this up being contaminated. Now, as you've seen, it was right by the patient's head, and if this patient had an airborne contaminant, they're coughing, certainly those germs have landed on this. I wouldn't want to be picking it up and putting it around my neck. So you're always thinking about what you need to do to avoid contamination to yourself, so that you're not also going to be then carrying it down to the next patient. So I cleanse this. I'm going to use it now. The blood pressure cuff that's in the room, it's okay to go on and use it for that patient because I'm not introducing any new germs to him. I can use my watch and check my pulse as I need to. It's inside the bag and it remains clean, so it's not a problem. As I continue doing my patient care, I'm going to change linens. As with any patient, I want to make sure that I'm not flipping the covers around and causing those germs to go airborne. But especially with the patient in isolation, I want to be cautious. If I have any wet linens, as I change the linens, I want to make sure I roll the wet linens to the inside, and especially when I'm using a dissolvable bag, I don't want the bag to dissolve before I ever get out of the room with it. All of my linens I'm going to place inside the bag. So we'll say I have this huge bag of linens, just for good measure here. This is all full of my linens. All right, so I have completed all my care, and I'm going to put my call light on, call my coworker, and, oh wait, I forgot. You forget a lot of stuff, you're going to make enemies with your coworkers because they only want to come once, because they have patients too and they're very busy. So I'm going to open this in a sterile manner, pull it out. Let's say I was supposed to culture his trach, and I'm going to cause some friction. Oh gosh, he coughed. I got a good sample. Open it up. And at this point, then I want to label this correctly, and then I'll go ahead and put it in a second bag. Excuse me, in a bag. Seal it up, and I'm good. Okay, so I put my call light on, and my coworker arrives. I'm going to go over to the door. Since she's on the outside, I'm going to allow her to open the door. I'll stick my foot in it, okay? And, for example, she's a new employee and doesn't know what to do. So I'm going to tell her to be sure and cuff down the edges of her bag and make sure that her hands are out of the way so that I don't accidentally contaminate her. And I'm going to roll this up, and then I'll stick it down in the center. She will seal the bag without contaminating her hands. Okay? And now she needs, I'll tell her to get another bag so that we can double bag our linen. She cuffs it over her hands. She holds it away from her body so that, again, I don't take any risk. I can touch the inside of the bag because it's going to be contaminated. Put it in. She seals it up without contaminating her hands. Now, she does not need the isolation garb on in order to take this stuff. She's standing outside the door. But it is a good idea to go ahead and put gloves on. I will say that. With my watch, so for example, the outside of it is contaminated and the inside is clean. So I'm going to reverse the process that we've just done, and I'm going to open it up so then that she can reach inside and get it out without contaminating her hands. Okay? All right. So she leaves it in the ante room. It's waiting on me when I come out. She goes on to do her work. This I will put in the trash can inside the room. I'm ready to disrobe. So I am at the door, over by the door. I need to remove my,
Okay, pretend to be your trash can.
oh, okay, so we're on the trash can.
Yeah, pretend.
So I need to remove my gloves. I'm going to grab them here at the palm of my hand. It also helps if you put your thumb down on your finger. That way they don't come off completely. And then I have a thumb. There we go. And I can touch the inside of the gloves. Okay, so I remove my gloves. Then anything below the waist is considered extra contaminated. I'm going to go back here and untie. I'm going to let my strings drop. I'm not going to, it seems that we kind of want to always pull this away from us. Don't touch anything. Untie, let it drop. Then I'm going to wash my hands. So I do a quick wash so that my hands are clean. Then I can go to my face. If I have the safety glasses on, I would want to remove them using the side pieces of them. Gosh, and I do want them all. And then I'm going to untie my strings, and you know, I forgot that these don't have strings on it, but I would untie my strings, top ones first, pull them around here in front of me, and then do the bottom ones, and then I'll hold on to it. I certainly don't want it to swing out and contaminate the wall, cause any problems. With this one, I'll just pull it off. That was a cheat. Yeah. Okay. So the next thing I can do then is untie my neck. All right. And then I want to pull this off of my hands. I had my gloves covering the edge of my cuff, so I can still stick my fingers under here, pull it down, cover my hands, and then I'm going to reach to the other palm and pull my hand out without turning my whole cuff inside out. Now certainly if you say, for example, you are grossly contaminated, visible soiling on here, you could see the difference, how it would certainly be wrong for me to reach up here, rub all of that contaminants down on my hand. So as I pull it off, I'm going to be cautious and just get out of there. I don't want to touch the floor. I want to roll this inward so that all the contaminants are on the inside, and then I want to keep my hands on top, roll it up, and I'm going to leave about a foot or so at the bottom, because as I've walked around in the patient room, I don't know if this is contaminated on the inside or the outside, and I don't want to contaminate myself. And I put that in the trash, and then I'm going to do a 3-minute wash to completely finish.